Eric Hammer here, registered physiotherapist and owner of Home Comfort Physiotherapy. Today, I'd like to talk to you a little bit about preparing for your post-total hip replacement. And so before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, in preparing for the total hip replacement, I think one thing that comes to mind is the fact that there might be some restrictions in terms of after your surgery. So one of the big ones, right, for lots and lots of patients is the idea of not being able to go past 90 degrees in terms of hip flexion. So basically this is 90 degrees, so there's going to be that sort of restriction, right, in terms of your ability to go past that, at least for an extended period of time post-surgery. And so certain things that you're going to want to be prepared for or aware of are going to include, number one, having a raised toilet seat, because again, those smaller seats, they're going to force us past that 90-degree hip flexion mark. Other things, again, going in line with this restriction is going to be having some kind of a reacher of some type. So again, reaching down for items on the floor, you're not going to be able to do after your surgery. So you're going to want to have some kind of grabber of some type. And going along with that, for putting on your shoes, socks, you're going to want to have a long shoehorn, right? Because again, you're not going to be able to bring those your socks and your shoes up towards yourself. You'll also perhaps want to have some kind of footwear that you can just slip on, again, for the same sort of reason, so that you're not having to tie your shoe. Other considerations might be, depending on how your house is set up or where your living is set up, is stairs, right? So for some individuals, they might have their bed and everything they need on one floor in order to minimize having to go up and down the stairs, as this is going to be quite challenging post-surgery. Now, if you do have to go up and down stairs, let's say you've got stairs going out from your driveway up towards your house, you're going to want to be aware of the idea around going up with your non-affected, your good, quote-unquote good side, and down with your affected side. This is going to put less stress, less weight through your surgical side, at least starting off. So these are all, again, things to consider prior to your surgery. So having your house set up in a certain way, getting these different items, as we talked about, the raised toilet seat, the grabber, the long shoehorn, these type of things, in order to prepare yourself for your coming home from your surgery. If you have any questions, concerns, feel free to leave a comment below. And if you require any in-home physiotherapy services, feel free to reach out and click the link below, which will set up for a free initial consultation in order to figure out, how I can help you. Also, please check with a physiotherapist to make sure this or any other information is appropriate for you. Have a great day, and thanks for watching. Take care.